Dr. Sanchez here from Radiance MD. And what we're going to do here today is talk a little bit about your background and about, why you went from where you were to where you are today, how you got there, what were some of the shifts and observations that you saw along the way. And then we'll get into a little bit of the transformation behind the work that you do for your patients. And then we'll talk a little bit about how you look at red light therapy in terms of the innovation that may be available through red light therapy in conjunction with everything that you offer. And we have Mike Genovese, founder of RedVive and Innovators of Health. Mike, why don't you just talk a little bit about RedVive real quick as a background and then kind of set the stage and get right into questions with Dr. Sanchez.
Yeah, sure. Thanks. So RedVive Health is, we're trying to reach out and get better outcomes for medical practitioners of all sorts, because photobiomodulation, red light therapy it's not just red light. There's red light and near infrared. And if you have the right combination with the right technology there, that's come a long way, you can make an incredible impact on the muscle skeletal. And that's where it all started, with a regenerative medicine doctor who is a radiologist by background and seeing MRIs and seeing improvement in the muscle skeletal much faster, stem cell proliferation, all the things that have to do with our healing and recovery and pain management. And so we extrapolated that to, wow, if this works at his clinic and his treatments, where does it not work? And we didn't find many places. So we want to reach out, and RedVive's mission is really, it's not about red light therapy. It's about helping physicians get better outcomes for their patients. And at the same time, there's a financial benefit to them naturally, but it's all about just generating better outcomes. So Dr. Sanchez is a close friend and also here in the local area, and so she's kept up to speed on what we've been doing and growing. And sure enough, her business, seems like a great fit as, maybe a third leg to the stack of things that she does to get better outcomes for a patient. So we've started this journey together, and really excited to have her on and understand her journey and what she's doing as an innovator of health. So let's jump into it.
Okay.
Yeah. So Dr. Sanchez, let's, take me through a little bit of your background. I'm incredibly curious about how you went from theology and philosophy and to medicine.
Yeah. So I come from a family of a bunch of physicians. My three brothers and my dad and my sister-in-law were all physicians, or are all physicians or dentists. And so I'm the baby of the family, and I kind of didn't want to just follow in their footsteps. And so I decided I'm going to take my own path and only end up in medicine if it really is the right fit for me. So faith became a very important part of my life when I was in college. And so I said, okay, first I'm going to focus on the spirit. And so I went to Yale and have a master's in theology and really study that. And then I said, well, that's just one piece of the whole. I need to know about the mind. And so then I went to Cambridge in England, and I got a master's in philosophy and looked at the mind. There was always a part of me that was really interested in the body, because I was a personal trainer since I was 16. And I wanted to study that as well. And so when I was in England, I said, okay, I'm going to apply to medical school. And I hadn't done any science in 9 years. And I just applied and got in. And then so I just started medical school. And so it ended up being that I wanted to treat the mind and the body and the spirit. But I really had a hard time in fitting in corporate medicine to doing that, because I had 10-minute appointments or 20-minute appointments. And so that's kind of what made me leave corporate medicine the last year and start my own business. It's where I could spend time with patients and really address all of these modalities. Yeah, I've been part of multiple ones, and it's not even necessarily a particular one that's challenging. It's really all of them these days that it's about just throughput. I will say there was my supervisor at the last company that I was with. Her tagline was "Treat and turf," and so basically each patient was get them in, get them out as fast as you can, see as many people as you can as fast as you can, and that just didn't sit well with me. That's not why I became a doctor.
Well, and we're going to get back to that in 1 second, but I'm really intrigued by you went from the spiritual side into into caring for people, and
Yeah.
bringing that connection. Let's talk more about that because it seems like that is a really powerful, a strong part of what you do today at Radiance MD. So let's.
Yeah. So, I called it Radiance MD because there's a message about those who look to God are radiant. Their faces will never be ashamed. And so that's for a lot of my patients, they've faced. So I have a weight loss practice, and they have been condemned and shamed, had a lot of trauma, and kind of misunderstood. And so really it's about helping them to receive love and acceptance, not only for themselves, but just knowing that I accept them too. So I actually hug all my patients on the way in and on the way out if they're open to it. I don't force that on them, but they know that I love them, and I'm really kind of in the trenches with them. I lift weights with every one of my patients during the appointment, and I also go on hikes with them in the summer weekly. I actually am a dance instructor too, and so I do little dance videos with them. So I have little TikTok videos that I do with my patients, and so it's all kind of an idea that I'm there with them. They're not alone, and I'm not just kind of standing over them pointing a finger. I'm really engaged.
That's so different. I don't think
Yeah.
I've never heard of any physician dancing with their patients, working out with their patients. I mean, that truly tells me, the essence of why you started this, and you're carrying that forward in your practice today, which is really awesome to see. I mean, Mike, have you seen anything like this before?
No, and that's really got my attention, where I was like, wow, here we are, good friends and neighbors. And then I learned more about what Dr. Sanchez is doing as a business and as a provider. And I'm just blown away. I mean, I don't know if anyone knows, and Dr. Sanchez, you can elaborate, but I think her patients get like a personalized hour. I mean, who gets that, right? Who goes to the doctor's office and gets a personalized hour that affects them?
Every month for 6 months too. I see them every month.
Right. So so there's the system is incredible, and there's like nothing like it. And I'm so excited for your business and where it's going to go. Everybody needs more Dr. Sanchez in their life, and the fact that they can get a personalized hour, it affects their mind, body, and spirit. And not to mention, I mean, I'm going to let you talk about it, but there is a crazy trend going on right now, and you start to hear it on the radio even, how you can get these GLP-1s, right? Different pharmaceuticals that
Yes.
people, in a sense, could be abusing. And you're one of the very few that I see, and what I know is helping folks responsibly use that pharmaceutical and eventually get off of that and have this
Yes.
incredible life and longevity to life, versus those folks that might be abusing it and that are really maybe doing harm in the long run. So I'm just fascinated by your whole angle on health and wellness.
Well, that's a really important point, because you can go online. Even during the Super Bowl, there was an ad where you can just kind of order it online and just pay $25 a month and not be monitored at all. And so I only do the FDA approved medications. I don't do the compounded ones, because you have no idea what you're injecting into your body with these compounded medications. And so I don't do that. I do labs after a month and then every 3 months. And then the main thing I think that also relates to Red Vive as well is that I do a body scan every month. So it's a 3D optical imaging body scan that tells about lean body mass gain and body fat loss, because that's what a lot of people are concerned about with these medications. And that some studies are showing us that if you only do the medication, that you lose lean body mass, you lose muscle. And so we want to make sure that patients do not lose lean body mass and that they're actually gaining it. So every month we test them. Patients love this 3D optical imaging because we can see the inches lost and then all these different measurements. But with, we want to, not only with the weightlifting, we want to gain lean body mass, but that's another important part with the red light therapy, where I could see that it's useful is one with the weight loss and the joint pain to kind of help them do more exercise, but also with the lean body gain. So we can help their metabolism be faster and they can keep the weight off it and get off the medication.
So does everyone who are on these treatments lose lean body mass? Is that a common side effect?
No, only if they're not doing any weightlifting. And so that's what I can actually show you incredible evidence on my patients that they're actually all gaining lean body mass. But I wouldn't say every one of them. There's a few that come in to see me and like, oh, I was told that I don't have to do anything else, or I don't have to lift weights. And those people do start losing their muscle. And so that's why I kind of say, look, if you're going to be wanting to get off this medication and you want to get long-standing results, we need to lift weights together. And so it's kind of nice to be able to show them. So yes, they will lose the lean body mass if they don't do anything else.
So they'll lose fat, and they'll also lose muscle along with it as well if they don't work out to maintain their muscle and keep on growing those muscles. But if they continue that, then they'll get the benefits from the treatments. And what happens when people no longer, use the GLP-1 supplements or the treatments? Does the weight come back, or is there a way to maintain a better healthy lifestyle without gaining all of that back once you're?
Yeah, and you can even see on my website, I have many patients that have lost over 100 pounds, and one guy that's down 200 pounds, and they are off the medication now. But what I do after I go through it's kind of 6-month increments that they see me. So they sign up for a 6-month package, and then some of them, need to keep going, and they'll keep doing that. But once they hit their goal, then I see them every 3 months over a year. And so I have kind of a maintenance plan. And so those people, I continue to do the body scan. And if we need to kind of tweak things, or if they need to get back on the medication, we can do it for a while. But most of them, take off. This one guy who's one of my favorite patients who's lost 200 pounds. He's now, his whole life has been transformed. He's hiking and biking and he doesn't need to be on it anymore.
Oh, that's awesome.
And one other thing is that it's not just the GLP-1 medications. There's actually 12 different medications. I think right now that's got all the hype. Yeah. But, some people can't tolerate that. And so there's other medications they could be on too. It's kind of like I think of it like flippers. It helps you to get faster to your goal, but it doesn't. You still have to swim. You still got to do the work too.
So what are some of the other ones? GLP-1 seems like it's a big because of the hype. But what are you seeing that people aren't talking about, which you wish that most people would actually pay more attention to?
Well, yeah, there's a lot of oral medications. So one is the most effective other oral medication is phentermine, and it's a mild stimulant, but it helps them to feel more full also, as long as you don't have any contraindications. That's until the last few years, I was only prescribing these other ones because the GLP-1s were not FDA approved for weight loss. So I have patients that have lost 100 pounds on those medications as well. But again, it's not just about the medication. It's really, I kind of take what I talk about are the 5 pillars, which are emotional and spiritual wellness, sleep, the nutrition, which is extremely important, exercise, and then the weight loss medications. And then now red light therapy is also a 6th modality that we can use in that.
Great. Yeah. So it's a whole package, right? It's really about just redirecting the ship to, a healthier lifestyle. At the end of the day, they're coming out, they've got this catalyst to help them lose all this weight, but they've also are learning how to maybe exercise more and get into a rhythm, right? It's all about changing our patterns, right? So yeah, I think that's what's so awesome is you take an hour with someone and it can really help them change the pattern, because it's not just a 5-minute conversation that goes in one ear out the other, and we've got so many things going on in life. So yeah, but I think of you as a superhero. You're like one of the few that responsibly helps re-guide the ship with something that is incredibly powerful, right? And then getting them on a track where they don't need to go, they will not retract. It would be hard to retract if you reset a pattern, right? Because they'll have a new pattern. And yeah, when it comes to that the 6th pillar with the photobiomodulation, the way I see it helping the most is you're getting folks to work out where they maybe haven't worked out. And that hurts. I mean, when I go to the gym for the first time in a while, I could be really sore, but now I'm not. Like, I try to get as sore as I can, and I do not get sore. So if they're able to recover with healthier sleep and recovery overnight from a good workout with you, they're ready to go do it again, maybe on their own, because they've got that energy, that non-painful feeling. So I feel like it's just going to catapult. Just your whole program is really going to catapult. I'm excited for you.
And the other thing is that, so the majority of my patients are perimenopausal and menopausal women. I'm about to be part of this, speaker at this conference that Mike's going to be at too, about perimenopause. But, it can help with perimenopause and menopause, sleep disruptions, joint pain, weight gain, aging, all of these things that red light can be useful for all of those modalities. I mean, all of those things that we have with with perimenopause and menopause as well.
Yeah, that's going to be a great event. Let's talk about that for a second. It's March 15th. Is that open to all patients in the public or what? Yeah, a little bit about that because I think it'd be helpful for people to know, and if they can hear it from maybe a soundbite here, great.
Yes. So it's for physicians. We started what's called the Portland Menopause Collective, and it's Dr. Nancy Shipley, who's an orthopedic surgeon and regenerative medicine specialist, Dr. Aoife O'Sullivan, who's a menopause hormone expert, Dr. Andrea Matsumura, who's a sleep medicine doctor, and myself, who's obesity medicine board certified. We started this group, and then we're putting on conferences. We did one in November, and then we're doing this one coming up in March, where we kind of address all of these issues and for perimenopausal and menopausal women.
And who's this for?
Any woman, perimenopausal, menopausal woman, or their husband who wants to figure out how to deal with them. Yeah, actually, my husband came to the last one and he was like, oh, now I get it. Because, yeah, it's amazing. We don't realize how many of these symptoms can be affected when your estrogen goes down.
And what is when you say premenopausal, is that a certain age range where it starts to develop, or when does that start happening?
It can happen. It's most common in your early 40s, but 40s to late 50s are kind of the range of when it usually occurs for women. It's when your estrogen levels go down, and you can have so many different symptoms from all those ones I mentioned, but urinary issues and irritability and sleep disruptions and so many different things. It's kind of fun to all of us work together, this Portland Menopause team, that we can talk about that. And so my talk will be specifically about weight gain and how you can use all of these different things that I've discussed with the strength training, but nutrition, lots of protein. Women really need to have a lot of protein as they're aging. And the sleep is really important too, because you don't want to exercise if you can't sleep at all either.
You get a lot of patients who come to you postpartum, and after they've had multiple kids and now they're trying to shed off maybe that baby weight, and they're, going through different changes. I mean, they've already experienced so many different changes having multiple kids, and they want to now live their best lives and their best selves. Come across a lot of those types of patients as well.
Absolutely. Yes. And they have maybe been fit their whole lives, and then they kind of have a child, and it makes it really a lot harder to lose the weight. Or when you get into your 40s, it makes it really tough to lose weight. So they come see me. And I have kind of an interesting niche of patients that about 85% of my patients are doctors themselves. I'm a founder of a group called Oregon Physician Women's Group in Oregon and Washington, and it's 1,900 doctor women. And so I started this, that was maybe about 10 years ago now, and it's just kind of grown as it's a underground Facebook group, so you can't search for it, where we can kind of communicate and have, when I was running it, I ran it for 5 years, and now I'm kind of the grandma of it. And so I would have an event, 1 to 2 every month that I organized. It's just something I did for free, but it's just because women physicians have a much higher suicide rate than any other male physicians or most specialties or careers. And so just was like a group that I wanted to start to bring people together. And so anyways, I have a little niche of that, of physicians who come to see me.
Wow. Sounds wonderful. Can you take us back when we started this, when we were talking about healthcare networks? What did you see previously in medicine that made you make the shift into where you are today? I think it's really important I'm curious. And at the same time, there's so many people that are practicing medicine in that way. Maybe they're seeing some of those observations that you made at that point. Some are maybe looking to make that shift and they just don't know how yet, and they're just still in that process. Talk to us a little bit about that.
I think that physician burnout, or just feeling that they're exhausted and devalued and not practicing medicine the way they want to, is really rampant right now. And that's one of the reasons why I have so many physicians as patients, is they are really unhealthy themselves, because the expectations are insane. You feel like a robot, honestly, where you wanted to take care of patients, and instead you just feel like a factory worker. And it's the CEOs that are making many millions of dollars. I don't know if you've been watching, there's a big strike here in Portland. 5,000, it's the largest, well, it's the only physician strike in Oregon history, but there's 5,000 healthcare workers on strike right now. And I think they're like 39 days or 37 days on strike. And it's because healthcare workers just feel like they can't do what they want to do, which is take care of patients. Instead, they're just trying to put out fires, and it's not even safe anymore. And so I couldn't live that way anymore. Again, it's not just a particular system, it's really all of them that I've seen here. You really have to leave the system to find joy in medicine again. But, it's hard too, because, I don't have any business background. And so I'm really been kind of flailing over the last year, trying to figure it out on my own. And I've made mistakes but it's kind of come together. It's really thriving practice now, but I've had to really learn it on my own.
Well, it's an interesting time because there are so many advancements and technologies that are happening, and not necessarily, there are technologies that have been around for a very long time, such as AI has been around for a long time. It's nothing new. It's exploding right now, similar to red light. Red light has been around for a long time, but there's now an inflection point where we're reaching, where it has an opportunity to intersect with and really start to create a big shift in terms of how people are going to take medicine into their own hands in partnership with their doctors like yourself.
And I actually go ahead, you finish then.
No, I was just thinking, it was going right back to you. I just wanted to, how do you think about that?
I actually use AI a lot in my practice. And one of the big things that I do is I have on my phone the AI scribe, and then I just put it next to me, and so I get to actually look at my patients in the eye and talk to them instead of having to type the whole time. Yeah. I'm looking at them, and my scribe takes notes for me. So we sit down, we do the staiku, we sit down just for a few minutes, and then we're up. And so our appointment is walking the track outside, and then because I have on a rooftop track where I'm working, and then we're lifting weights together. And so the AI scribe.
Recording in progress.
We lost him. Oh, there he is. I thought you had maybe frozen there for a minute.
Yeah, you guys froze too, and then it just suddenly everything changed. So. And
you moved positions too.
Make sure we're recording here. Okay, cool. We're back on track.
Did you get the part about the AI scribe?
Yeah, I lost you right when you were talking about you're using an AI scribe so you can look at your patients in the eye and be there with them. And then that's when it started to cut out.
Okay, yeah, I was saying, and so I would go walk on the track and lift weights with my patients, and then I just have my AI scribe going. And so I usually only have to spend about 5 minutes on charting per patient versus it could be an hour before. So that's really been life-changing. And then the other way I use it is that I have it help me make a meal plan for patients. And so what I do is I get on ChatGPT and I say, okay, please help me develop a 7-day meal plan that is, I decide on what macros after I talk to the patient, but say it's, 1,400 calories and 20% carbs and, 40% protein, whatever. I will make a macro plan, and I'm typing and I say, okay, tell me what foods you hate. And then I'll type that in, and then tell me what foods you love. Tell me what foods you're going to eat no matter what. And so then I put all that in there, and it gives me a 7-day meal plan plus a shopping list at the end. And so I can send off the patients with that.
The fact that you use AI with your patients, to enhance your practice and to even create a better quality of care with your patients that's innovative in itself. That I know there's plenty of physicians that want to do it, but they haven't figured out how to do it. And to see you actually doing it is awesome.
Well, and one thing I have had to do is, because AI still is not perfect, and sometimes the macros or the calories it kind of comes up with are a little off. And so I'll say, please, and I'm actually very polite to my AI here, but correct if there's anything that is not right in macros, double check it and double check it again. And so sometimes it will correct itself. because it will come up with calories that are not right or things like that. But overall, it's not an exact science. So if it can come up with a meal plan that the patients will actually like and the foods that they like, but just healthier choices in there, it's phenomenal just to kind of be able to send them immediately off with a meal plan. They don't have to wait for a nutritionist or anything like that.
Absolutely. And there's so many new things that with even ChatGPT, where you can use computer vision for it to look at the refrigerator or the pantry of the person and scan, and based on that start to suggest different recipes and different things that it can that you
Wow, I haven't seen that.
because of that. And, and even if they just take pictures of what they're eating, what are you buying? What's in your pantry? They take those images. If they were to send that to you, now you have some correlation between what's already in their pantry, what's also in their refrigerator. AI can also take that together and start to create a meal plan based on their numbers, that you're tracking. So you can keep all of that in sync. So rather than you just doing it, you can do it in tandem with them. And those are some really interesting ways to utilize AI today that keeps it somewhat engaging between your patients and yourself, and you're being able to utilize that back and forth. But
that's really interesting. I haven't thought of that.
Yeah. And that's what's exciting about this time, right? Because we're able to utilize new technologies in new ways to enhance our health. And that's where innovators like yourself comes in, because you're leaning into these technologies. You're leaning into not just AI, but you're leaning into red light, leaning into it in ways that that it has benefits for your patients, and you're willing to actually go the extra mile to make it part of, what you're offering. So your patients get the best benefits out of it.
Another interesting thing that you can do with AI is say they ate something that was not on their plan. They can actually say, oops, I had 2 glasses of wine, rewrite it for me. And so then it can redo their plan for them.
Yeah. Oh, it can do that. And this is going to be, AI is the worst it's ever going to be at this moment.
Yeah.
So whatever it's hallucinating, whatever it's doing, it's not giving the most accurate information, that's right now. 6 months from now, everything will change. 6 months from, then everything will change again. And it's only going to just compound and accelerate. So
yes.
So that's...
I'm excited to use it. And I think that, it's important, though, to still have the human aspect of things where we, that I don't feel like AI is going to just take over. Because I think it's important to have where we're engaged with people. And like I said, I like to be down on the trenches with my patients. But it's such an important way that we can help them and to make things much streamline and make it much more instant, where we can help them find solutions quicker and also make our lives easier, where we're not having to spend our whole day charting.
So how do you find ideas? How do you think about when you're looking for innovation within your own practice, and when you start to make observations or things that excite you? Do you have a process? How do you go about that?
I think for me, it's really about making balance better for myself and for patients. And I can see as I'm talking, I guess what I would say is I have so many doctors as patients that I'm talking with them, and I'm thinking about, okay, what makes them so unhappy with their lives right now? And it really has to do with really the charting, rushing people through. And so each thing, as I'm seeing a patient as a doctor as a patient, I'm processing and trying to think of ways to make their lives better. And then also both as the doctor and as a patient. So I can kind of do both at the same time.
And is there a common theme that in terms of pain points that you're sensing from these physicians? Because if your patients are primarily doctors, is there a common theme that you're starting to recognize that when other physicians are listening to this podcast and this episode, are there things that, maybe they're not aware of that you're seeing? I'm just really curious.
I would say the number one thing is know your value. They have all this education and have been just reduced to being, the robots, and they're incredibly valuable and smart and caring, and do what it takes to recognize that value and make the choices so you can spend time with your patients, spend time with yourself, and spend time with your family. So whatever it takes to do that, don't just kind of suffer in silence and be by yourself in feeling. It's kind of what's called a moral injury, where they just are are not congruent and not feeling that their life has the meaning that it should anymore.
When you bring up red light therapy,
Well, at first, kind of, oh, that is that kind of woo-woo medicine. And, I think I've got Mike and, his team had sent me some articles as far as really looking into research about it. And so I now have those in my in my electronic medical record, and I send those articles to people so that they can actually see the research on it. And I think there's so much out there right now that people are just trying to make a fast dollar. And for me, integrity is the most important thing that I have. Like if I lose my name, that's the most important thing to me, is having integrity. And so I won't ever promote anything that it doesn't have any research basically behind it. And I'm never going to kind of push something just to make money. So I would ask them to just take a look at the articles about it and look at the research and do their own homework about it. But I'm also able to, now in my clinic, they can try it out too.
what have you seen so far with people trying it out in your clinic? Are there any favorite impactful sort of cases that you've seen, or results that you have?
Well, I mean, definitely for the joint pain, they're doing the lifting with me, and then right afterward, they're doing red light therapy. And so they're kind of feeling like their recovery is faster. As far as the weight loss, I'm kind of just getting going in that. So I don't really have stories yet on that, but the research is saying that there are good results with that.
Yeah, there's an article that blows us away. I mean, just to rewind really quick. Of course, our physician at first was like not totally sure. So it was working. We were feeling it. He was feeling it. Physicians wearing lead all day and their lower backs killing them immediately on impact on the first device that we put together. But we sent him to London for the World Light Therapy conference. They do it every couple of years. It's a massive group of PhDs and physicians, and they met in London in August. And he came back saying, wow, this is really real. But nobody believes it. It doesn't matter how many studies you read. You got to feel it yourself. So the first thing we do is make sure every physician, and we did the same thing with Dr. Sanchez here, and she took her time, because we've been talking about it for months, but she does have, a high regard for integrity. And I was like, here, take my panel from our house and use it and feel it before you even talk about it to anyone else. And she did that. So, feeling is believing. And then you start to read the articles. And one of the articles that stood out was, 3 minutes twice a week would reduce adipose tissue in the abdomen. And that was like, really? That article's got a lot of studies behind it. And of course, we shared it with Dr. Sanchez. And over time, as folks use photobiomodulation, it is meant to reduce fat tissue. So that's a big deal. Of course, that doesn't happen overnight. But when you combine it with everything else that you're doing with nutrition and exercise, and then an extra catalyst there where it makes sense in a pharmaceutical, then it's pretty powerful. So I just wanted to comment on that. And I appreciate you giving it a chance and taking your time and doing it the right way.
Yes. It's important to, that your patients trust you. And I never want to do, I was kind of talking with this personal trainer who was at a volleyball tournament I was with yesterday, and he's kind of promoting all sorts of things that I'm like, is that a doctor that's prescribing? Then he's like, I don't know, I just send them off and they're on all these peptides and all these different things. And I said, well, it's important, you're the one that they trust. You can't just send people off to do something. You have to believe and stand behind with patients trust you. And so not to do any harm to people. So I have been finding it to be really helpful for people, and they're all really liking the red light therapy that they're doing in the office.
That's great to hear. And we're just getting started, so it's exciting.
Yes.
That is wonderful. So Dr. Sanchez, I mean, you're clearly innovating in your practice and your space. You're using AI, you're combining all the different experiences that you've had before you jumped in to this, and you're really working with your patients. That's something that is a big takeaway here for me. Is I'm just wowed by how you really focus on your patients by being there with them. You're not just using these new tools, but working out with them, caring for their health. And it's probably the pinnacle of what, as a medical practitioner you can do, is be there with your patients. and walk them through their transformation. Kudos to you
No, thank you.
for doing that. You are an inspiration to many other physicians as well, and this is why you lead so many other doctors in your field. And people look to you for inspiration because you're doing these things. So yeah, I just want to acknowledge that. That's awesome.
Well, thank you. It's been a pleasure to be on here talking to you guys.
Yeah, thank you so much for your time. Yeah, we'll have you back on the show and for part 2, because there's just so much more that I know that you're working on that you'll have to share. So, and that would be a big benefit for everyone listening. So thank you again.
Oh, you're welcome. You're welcome.
And Mike, thank you as always.
Thanks for having me on, and yeah, glad to be here. Really lucky to be in this position.
I mean, it's exciting stuff. You've taken you're going after something here that can really be transformative to just millions of people. And, in partnership and working with, Dr. Sanchez, you're going to be able to put together, reach so many folks and create so much transformation in people's lives. So that's exciting. So
yeah, thank you both for jumping on today.
Oh, you're welcome. Take care.